mean, one way that we interact with government, for example, is that we will set up regular meetings with key people, for example, in Public Health England or in Department of Health or the Department for Education. And that's a really good opportunity to share what we're doing as a small independent charity, as well as finding out the government's priorities. So that's one very simple way, which I'm sure most people would do. But also when we have working groups, for example, we would invite government to attend those working groups, maybe as an observer, so they can interact with our staff to find out what our ambitions might be, what our work might be, and how it links to some of the government's priorities. So there's some of the key kind of working ways which we would do with government particularly. We are not a lobbying organisation, so we wouldn't go to government and demand things. What we would do is we would look at the evidence, we would have a discussion about what we feel that might be needed, and explain that in a rational type of way. But we believe in working in partnerships, and that's really important to us in that collaboration. So with schools particularly, we've been quite successful in over a number of years in developing sort of very good relationships with schools and local authorities, which is really built on trust. So our education programme, Food, A Fact of Life, started in 1991. So we have a heritage in working with schools. They see us as being an independent organisation. Our information is fact-checked at BNF. And what we do is try to provide information that's free of charge to schools, which is obviously quite, people quite like that aspect, and it supports the curriculum. So we're helping schools teach what they have to teach. And not only that, we're also providing, again free of charge, support for teachers. So we're making sure on one aspect there's resources to help teach the curriculum, but also making sure that the teachers are up to speed with the latest in nutrition, or we might organise visits for them to attend. So it's really a balance of both aspects that we work with them. For us personally, the healthy eating aspect wouldn't be a measure, because that would be linked to, for example, about school food provision, which is more controlled by government or on a local level. But even at that, there wouldn't be any health outcomes linked in England around that particular aspect. For us at the moment, the real impact is around measuring about learning, particularly, because it's very difficult for one small organisation to have an impact to say, by students using our resources or by teachers going on a training programme, we've solved obesity. That's not a silver bullet, but we are part of the solution. So part of that is those collaborations. So if we can work with school meal providers, the local authority, with government, I think we can all play a role. I do believe, though, there is room definitely for some measurement and evaluation so that we can show our impact, and that's something that we're continually trying to work on.